Hi, everyone. Welcome to Conversations, a Women's Congress for Future Generations project. Today, we're talking to Caitlin Farley. Caitlin is an anthropologist focused on community and global health, the role of culture and health, and the issues of trust between patients and health workers. Her graduate studies were based in Indonesia, working with traditional healers, ethnopharmacologists, and community members. She also completed fieldwork in Ireland, Singapore, and with the immigrant and refugee community in the New England region of the US. She is currently working as an HIV project manager and community health worker at a community health center in Massachusetts, and spends her weekends singing, sailing, and working on traditional wooden boats and exploring all the forests and waterways of her home. Well, hi, Caitlin. So good to
Hi
talk to
there.
you.
Absolutely.
Yeah, so we just want to talk a little bit today about your great work and kind of what led you into this field. So what inspired you to start to lean into this work?
So I actually originally started in a very different direction, like I think a lot of people our age do. I started in Egyptology and had to drastically change directions because around the time that I was looking into graduate school, the Tahrir Square situation was going on in Egypt. And I started to get really interested in, towards the end of my Egyptology work, in a lot of the medicines and things that were put in the tombs in the Egyptian burials.
Mm-hmm.
And I sort of had to go backwards and backtrack why I was drawn to Egyptology in the first place and figure out what else was possible for me with changing direction, and realize that that had kind of always been on my radar. I looked over at a bookshelf and there were like 3 shelves of Egyptian medicine and things like that on my shelf. And I was like, I'm really into healthcare and culture and where those intersect. And my partner right now, he years ago, we were just friends, and he introduced me to a cultural sustainability graduate program at Goucher College. And he had just started and gave a really glowing review. And throughout my time there, I just kind of was able to process all of that and blossom, and ended up going more towards global and community health work.
Awesome. So what did your time abroad really teach you the most about community health work?
That when we think about patients, that there's this like stereotypical image a lot of people have in their heads, I think, with the people who are scared, or scared in quotations, to access medical, Western or allopathic, as we call it, medicine, and prefer to rely on traditional, which is more preventative medicine. And the way that community of people, like each individual has their own reasons, and also across every culture, those reasons are vastly different. And so working in Ireland, working in Singapore, working in Indonesia, and working here in the US in my home region, the way that we sort of work in community health to figure out the way people define health, the way people make decisions about what's urgent and what isn't, and how to address it. It's so individual to people. And I think that's something that we're starting to see more and more as a trend in global and community health. It's less of a public health numbers focus and more of a medical anthropology focus, which is, of course, my close to my heart passion.
Mm-hmm. Great. Well, so I guess my next question is really, looking at your time abroad, and you've worked with quite a few different populations, but how, is that different from being here? Like, what are some of the similarities? What have you been able to bring back? But what are, like, the challenges and sticking points of all of this kind of cross-culturally?
That I think the thing that stuck out the most to me was the number of people I saw in Indonesia that reached the age of 100 and beyond and were still trucking, like lugging giant bags of rice uphill every day.
Wow.
And so many of them use plants and their natural environment to prevent, I guess, the degradation of their health. So just spending all that time outside, walking everywhere, maintaining motion, adding plants and medicinal plants to their diet every day. They don't need to go to the doctor for checkups every now and then. They don't, I guess, need to go to the hospital for as many emergencies. They don't need to have access to ERs as quickly. And so I think about that a lot with the work I do in community health centers here. It's almost so easy for me to work with the refugee and immigrant communities who have come from places where that is kind of the same for them. Mm-hmm. It's actually been harder for me, I guess, that reverse culture shock, to take that hat off and work with patients who have never had those as options. But in that process of doing that, I'm taking everything I learned from what good health looks like in people that, you know, the Western world would view don't have access to health, but yet appear to be so much healthier. Mm-hmm. And I take those lessons and try to bring them to patients here in the US that have never known that way of life as a standard way of being healthy.
And have you found that to be, I don't want to say easy, but have you found that to be possible with, you know, the current work that you're doing, you know, bringing those traditional medicinal practices here? Have you found applications in like your daily work?
It's less the traditional medicine and more the way of thinking about health. So I guess the people who utilize those practices think and define health and being healthy in a different way. It's far more about prevention, and there has been a push here in the US to get more funding. Like I was actually just at the State House in Boston recently to advocate for a further funding for a grant called the Prevention and Wellness Trust Fund, which is all preventative programs for preventing diabetes, preventing hypertension, preventing asthma. And so there is sort of a movement for that, but I find very often that there's a lot of pushback in both in the government for funding that, but also in the everyday person, because that's one of those things that it's like, we talk so much about self-care now. It's a real trending thing, which is, I think is great. But people don't have time. They always say, I don't have time to do that. So they don't have time to walk to work. They don't have, nor do they often have sidewalks or a safe place to walk. But, you know, I don't have time to do these things, to stand up and take breaks. I don't get to walk around outside. I don't get to do these things. And in other places, they have to do it. Right. It is a lot harder to translate here, and it's viewed here as a recreation, whereas in other places it's a necessity, and that's a huge difference.
Right. So what did your field work look like when you were doing that?
So it was different in each place again.
Right.
The primary, I was originally just supposed to do work in Indonesia, and as many people in the field learn very quickly, you have to roll with the punches. So I ended up adding other countries to my work on the fly, and it worked out. But my work was supposed to be just in Indonesia, and it started with reaching out to colleges in the area, universities in the area, and trying to make partnerships and see what research was already being done and get a feel sort of for also the government programs, any cultural programs. Like we think here, coming from, an anthropology or folklore background, oh, there's a state folklore program in every city, every state, and they support this, but, in another country, do they have that? So identifying those things, what was being put up as something of value and what was being thought of as something to get rid of from the old times. Mm-hmm. And so after forming that picture, I did research in which places there had been anthropological work done previously, just because I didn't really have the time to go find things on my own for the first time. And went to the island of Sulawesi, which most people don't know about. Everybody thinks of Java, Komodo dragons, Bali.
Yeah.
Sulawesi is sort of the octopusy-shaped one. And it has a largely diverse group, just largely diverse cultures there. It's a huge island, and it has a lot of mountains, a lot of rainforests, so the people were very cut off from each other for a long time. Mm. And so there are a ton of cultures just on that island alone. And I found a few that there were words in the language for like 5 different kinds of healers, which automatically tipped me off that there was a really rich healing culture there.
Right.
And I started looking for where hospitals were in the area and how many. And so I picked some of the larger for that area towns and started there and wanted to figure out what their approach was to that hospital, what their thoughts about it were, and just sort of go once I was in the field, which is kind of what you have to do if you don't have anything immediate. I got crazy lucky. I stayed in a homestay with a gentleman which is when a family opens their home to you. Mm-hmm. And he was a retired village chief and traditional healer.
Wow. That's really just, what's the word? Fortuitous.
It was both for my research, and I got sick at one point and he took care of me. So for that.
Oh,
wow. His whole yard was traditional plants. So traditional medicinal plants. So I stayed with him, and with an interpreter, we had a lot of conversations about the elders in that village and how they offered traditional medicine. And they would it seemed like they had a sort of system of determining, they knew when something was cancer somehow, and they would go to the hospital for that. They would try to prevent it and keep it in check, and they had their own observational system to determine this is out of our hands, we need to go to the hospital, and they would. And so that was all incredibly interesting to learn about. He took me to some other villages and introduced me to more people. I went to some areas that had been heavily influenced by Dutch missionaries who had converted the areas to Christianity, learning about what of the culture had remained from before and what had been converted. Was really interesting how it was enmeshed, and they still use traditional medicine there. Even the children, I talked to some 6 or 7-year-olds, and one of the words for healer is dukun. And when I asked them if they had ever been to see a dukun, they started laughing and made like spooky wizard faces and hands. And I like pulled out a translation book and went and like clarified specifically a plant-based dukun, because there are types of dukun that are like dark wizard kind of spirituality focused, and they're the ones you don't want to mess with.
Right.
And that's clearly the only thing the kids had immediately thought of.
Right.
And when I clarified the plant doctors, they went, oh yeah, they're like pointing and telling, like going off on this whole story that I didn't have an interpreter. So I don't know, but it seemed like they were telling me where one was. And so even in those places where you think, you know, I have no idea what I'm going to do, stuff just kind of works out. And that's sort of what happened for me with my field work.
Yeah, well, so, and you might not have the answer to this, but I just, based on that story, got curious, was between the different villages that you went to in Indonesia, did you notice any, and I don't know if they really keep track of this, different health trends between the communities who weren't converted by Dutch missionaries and who were? I'm just wondering if like that cultural influence has affected their medicine in a big enough way to kind of make it that's not as much their focus on preventative medicine as it is this other village that they're cut off from, but who kind of solely still utilizes that practice. Does that make sense?
Yeah, absolutely. I totally get what you're saying. The particular region where I was working, each of those areas were equally distanced from clinics and hospitals. So I think if that hadn't been the case, if the missionaries had also built a hospital or clinics, that maybe there would have been a bigger change. But I think because they still didn't have that easy short distance access, they still relied on the same medicines.
Interesting, yeah.
And because there were the different forms of dukun, a healer that works with plants doesn't necessarily have anything to do with religion.
Mm-hmm, right.
Their religion historically is animist, so based in nature. Mm-hmm. And I have found in my own experience that missionaries often have less success with converting in that way because there's not a God, like a person to person, like it's not a God to God exchange. Right. So they do tend to enmesh a little more. So there wasn't really anything for them to replace something with, if that makes sense.
Yeah, it does. That's really interesting. I mean, obviously I don't know, but your logic there seemed really sound. That's fascinating. So I also wonder, did you have any conversations with, the healer you stayed with about traditional ways of healing and plant medicine and kind of the effects of climate change? Is that impacting, the plants that are available to them? And did you experience any of that in your field work where they were kind of talking about that?
So this is actually something I pay attention to a lot. I've seen in my own research as well as in the field work, it's one of the first things people will mention of their own accord without being asked. The concept of global climate change is not always the way they're thinking about it. But
they know, like, that it's, something is different and...
Mm-hmm. Absolutely. It's often they can tell the soil isn't as healthy, so there's less of a plant, or it's smaller, or the medicine in the plant is not as strong. They have to use more of it, and it's harder to find enough of it to make it strong. Or they'll tell me when plants have disappeared completely. Although sometimes that's biopiracy, not necessarily climate change, and they won't know which one it is.
Well, can you explain a little bit of biopiracy? I've never heard of that
before. So bioprospecting is when pharmaceutical or like people trying to find new plant medicine will go into communities and identify a plant and then take it to a lab and synthesize a chemical version so they don't need more of the plant. Biopiracy is when it is taken, often intellectual property is violated. So
Mhm.
traditional knowledge from communities and try to patent it. There are often attempts by a company to patent a plant in its raw form, which is not legal. Um,
Right.
or there have been cases of maybe all of the roots of a plant being ripped up, or all the bark being taken off every plant findable, and a plant going extinct.
Oh my gosh. I mean, ridiculous. Yeah.
Yeah, so that's biopiracy. So if they can't find more of it because it's all been pulled up, or it looks like it's all withering and dying because the bark was taken off in the night by a local who was paid a lot of money, they don't always know what the cause was, which is hard.
Yeah.
They definitely always. I've watched documentaries about there's a really amazing documentary about medicinal honey in Nepal called The Last Honey Hunter by Renan Ozturk. And it's a Nat Geo documentary that people should totally check out because it's a really good example of all this.
Well, I'm definitely going to be. Thank you.
Really, they flat out say, like, there are these really isolated mountain village of Nepal, and they are just now getting their first paved road. And they straight up say in the documentary, climate change is killing all the bees and there's no honey left.
Wow. Yeah. Gosh.
Direct identification of it.
Yeah. I mean, I talked to you a little bit about this when I was actually doing my thesis, because I was looking into some climate refugee work and how, people are coming over from all different countries, and, they are all of a sudden subjected to our way of medicine, and that doesn't really compute with them. It's not compatible. Their health records are a mess if they even have them. But there's also all of these, they're not even really psychosomatic. It's, being taken away from your homelands and your ancestry has such a physical effect on people. So now, what you're describing are all of these people who are still on their ancestral lands, who are having their ancestry and their history and their way of life and preventative medicine taken away from them, even on their own land still. So it's just, fascinating, but horrifying all at the same time.
Yeah, and it's not, it's the water, if they're downstream, it affects them, and they may not know why the water is suddenly bad or why it's killing things.
Right.
Natural disasters, increasing erosion, mudslides, landslides, that they know why. So it's definitely hard, and it's been a big part of the debate in the anthropology field around deciding when the line is crossed where contacting a previously minimally contacted tribe is necessary for their survival based on the world around them basically leaking in.
Right.
Environmentally, not even culture,
right.
and diseases or T-shirts or video cameras, but they can't find anything to hunt, or they can't find the plants that are their medicine. And there's a lot of, there's a lot of national parks being built as well that indigenous people live on the edges, and there's suddenly a wall built overnight and they can't go on to the area where they would pick their plants before.
Yeah, have you ever heard of Dr. Dorceta Taylor?
No.
She is just an incredible person, but she also is this incredible academic, and she's written several books. All of them are amazing, so highly recommend. But there's one that she has and it's more focused on the U.S., but it is about kind of the rise of the national parks and how that's a form of institutional racism and environmental injustice, because these people have lived off of this land for so long, and all of a sudden we're taking it away under the guise of saying, hey, well, we're protecting it and conserving it, when they weren't the problem. They were protecting and conserving and taking care of the land for so long before that park. So it's very interesting. I would recommend that, but it doesn't talk anything about, I don't think, Indonesia, and just, gosh, contacting tribes who, you know, are kind of off the grid. But that is fascinating. Thank you for that.
Yeah, I mean, that's a whole subject I could, of course, talk about for forever.
Yeah.
Survival International is a nonprofit that is an indigenous rights group, and they've kind of been whistleblowers on that subject all over the world. So they're another good one to check out.
Yeah, make a note of that. So, I mean, this is difficult work, you know, abroad, here in the U.S. What kind of experiences led you to be willing to go against the grain in this way, in this field? Because I know it's difficult to really get into the kind of work that you're really passionate about. What decided that, you know, this was it for you? So I feel like it's brave, you know, it's a big deal.
I appreciate that. I think everybody has something that they can't stop reading about, no matter how angry it makes them.
Mm-hmm.
And you find that thing that you just keep researching and you just keep learning about, and you find yourself doing it on your free time, and you find yourself staying up accidentally until 3 a.m, or you're on your lunch break and you're reading about it. And you're talking about it all the time. And I think everybody has something like that. And it might not be an advocacy thing. Maybe it's art, maybe it's space, maybe it's robots, you know. But I think if you have the opportunity and you find yourself consumed by something, you kind of just gotta try to go after it. And not everybody has that opportunity. And I started out and I did robotics in high school, and maybe if I'd done that, I'd be making $1 billion. But, and you know, global health and advocacy in any way is certainly not always a super comfortable field to be in. Mm-hmm. But I just can't really stop. And anytime I start to feel myself get pulled a little bit off the path by somebody's suggestion of maybe some amazing career opportunity, or a project, or even sending me something to read, I've gotten to the point where I'm just like, I recognize how that is a little related, and I am aware that everything is connected, and I definitely web out and go down different side paths to expand my knowledge of how interconnected everything is. But I still have this focus of, no, that's not quite it. I need to put my time into this thing. And it's been more and more about health and listening to people, giving people a voice to talk about what they want to be healthy, and not telling them what healthy is. Mm-hmm. Mm-hmm. And then working to make that view of health possible for everyone.
Yeah, that's incredible. So what kind of advice would you have for the people of all ages, elders, future generations, young people who are looking to be advocates in this line of work?
Start on the front lines. If you want to be a doctor, start out as a community health worker. Because being in it, really in it, and like hearing all the stories and seeing the complexity and really getting it instead of just saying, I think I understand it, and then steamrolling over the reality of what people are living and putting your own proposed fixes that aren't based in reality.
Yeah.
It's just so important to really be a part of the community and really hear them. And even if you do move up and away, which is often the only way to make a sustainable income is to distance yourself from people, you have to move up, and that's unfortunate. And I fight with that a lot because that's not really what I want. But taking that knowledge of what the reality is and then applying it is so vital for any policies, any change to actually make change. And remembering and continuing to keep your finger on the reality and touch base with it every now and then, dive back into it, go volunteer again for a little bit and remind yourself and see how things have changed, and just keep doing that. And you'll actually be able to take whatever privilege or gifts or connections, networking you've been given to do something with that knowledge. You actually can take all these things and apply them in a real important way.
What do you wish that someone had told you when you were first starting out? Is there anything that you feel like you have learned that has been seminal and that you wish that someone had just told you that before all of this started?
I know this sounds really silly, and I imagine this is just a difference. I grew up in an area in Georgia that was a very much lower income region, and so the school programs didn't have counselors and things that would prep you for college, and then even my undergrad didn't have people who would prep us for grad school. And so throughout all of my time early on, where people have those first opportunities to get that on the ground experience earlier, through volunteering or learning about opportunities, I didn't know what I didn't know.
Right.
I didn't have any idea that those were things I should have been doing. And if I had done them earlier, then maybe I could be taking everything I know now and applying it already. And so I feel a lot further behind than where I wish I was.
So what do you see for yourself as your aspirations moving forward?
I would absolutely love to work for Doctors Without Borders. And again, I know I'll start in the field, which is what I want, but I would love to change the way any relief group, when they go into a community that is not their own, have more initial steps be based around listening to the community and getting to know that community, and not applying a cookie cutter relief effort, because the exact problem is why the Ebola outbreak is so bad right now.
Right. I'm just nodding my head so vigorously at everything that you're saying right now.
It's my dream is to change the policy across the board, that it is standard to have 500 community health workers and elders and traditional healers on a board advising implementation.
Yes, that's incredible. Absolutely. Yeah. No, I mean, it's needed, and it's very clear that you only get so much out of a textbook, and then you kind of drop people into a community, and it's just not, it's not as effective. There's not this pre-learning work. And on the one hand, I recognize that, they're being put in these situations that are extremely urgent. But at the same time, in order to work on the prevention side of things, you need this pre-work and community listening. Absolutely.
There's something you said earlier You were explaining about that doctor, the professor. There's a huge movement in, I think, almost every field, and I've seen it myself in conservation and in health, and it's decolonize global health, decolonize conservation.
Yes, absolutely.
It's exactly what we're talking about here of don't implement what you think is right because it's not based in reality.
Right.
So vital.
And so I studied abroad in Australia, and I actually took medical anthropology while I was there, which was incredible. But one of the things that we really focused on was the fact that there were, all of these Aboriginal tribes that they were, the Australians were trying to like create these jobs for the tribe members, and saying, well, if you don't want to participate in this mining work that we've created for you on your lands, you're just lazy. And one, you are destroying their land, so of course that's not going to be something they want to do. Of course, some people want to be paid any money at all, so they're kind of forced, their hands are forced in that way. But two, the traditional tribe like mentality around their work for the day and how they see their purpose in life, and just their mindset is completely different from this, you work 9 to 5, you do all of these things, and this like Western mentality of success and whatever. But it's actually their mindset, and their conceptual reality is it's just different, which is something that's so, once someone explains it to you, I feel like it's so obvious, but it's not a connection I think anyone who's educated in the traditional like Western system really makes the connection about on their own, because it's just not our experience. But I think it's fascinating, just because they were like, well, that doesn't make sense to us. Why would we do it this way? That's not how we live. That's not important to us culturally, and with, the rules of our day-to-day lives, that doesn't fit. I just thought that was incredible. And of course, that touches on so many different subjects.
Mm-hmm. It's applicable everywhere. It's that classic anthropology concept of emic versus etic perspectives, of being an insider. You can't see as much if you're an insider.
Right.
To be an outsider, to observe differences. But if you don't, like, you see different things based on if you're an insider or you're an outsider, and the sweet spot is somewhere in between, and that can only be created through conversations between people that are emic and etic perspectives. And it's so hard to turn off your way of knowing and to listen and really hear someone else's way of knowing, and to listen between the lines. And did you ever read the Nasarema?
Oh, yes. Actually, what's really funny is that we did, it's like the Nasarema unit in middle school.
What? That's so
yeah. So it was I honestly, I don't think we spent more than like 2 days on it, but it was what do they call it? Social studies. It was a social studies lesson. And that has stuck with me probably, from that day forward. I always think back on that. And like, the first time in my mind it clicked of the word backwards, I was like, oh man, even as like a really young kid. But yeah, so I haven't read the book, but that was an actual lesson we did in middle school, which I thought, looking back now, I think is so incredibly like forward thinking for that teacher to have done.
Yeah.
Because other kids in college, when we would be in like an anthro class, they had no idea. Like, well, we did this in middle school. That's so fascinating to me. Yeah.
Yeah. So for anybody that hasn't read it, Nasarema is Americans backwards. Spoiler alert.
Yeah. But it's really cool because the way that we did it, our teacher, Miss Bloom was her name. She, she kind of says, oh, well, this culture, has an emphasis on piercing your ears, or, you're something like that. So it sounds like all of these crazy practices that you're so unfamiliar with in your own day-to-day lives in your culture, and then you realize that Nasarema is just American spelled backwards, and everything clicks and falls into place, and you're like, especially when you're so young, like your mind is kind of blown. But I mean, maybe at any age your mind is blown when it comes to that, but it's great. Yeah, absolutely.
So good.
Yeah, it just really changes your perspective.
Mm-hmm.
Yeah, so maybe if everyone did that in middle school,
yes,
we'd be in a different place.
Yes, anthropology classes in middle school, please.
Yes, I think Miss Bloom was ahead of her time. So
It sounds like you had a phenomenal teacher.
yeah, wherever she is out there in the world, Yeah, that's great. So before we wrap up, what is there something that you were hoping I would ask but I didn't? Or something you wanted to talk about that I didn't bring up?
No, I think we managed to. I think you and I have enough that we probably figured out that we can talk for a really long time.
Oh, definitely. We've always known that, though. We've known each other for a little while, and we've never really been able to have that conversation. So one day soon, for sure.
Yeah, we'll have to sit down and definitely just like spiral for hours. But
absolutely. But this is a good start, and I'm really excited for everyone to hear this episode and to hear about your work and your interests and just all of the great work that you're bringing into the field. And I know that you're one person, but you are just this phenomenal badass person who brings so much to the table in every conversation. And so I know that all the community health work that you're doing is really impactful, even if it doesn't seem like it day to day. But I'm happy, and I feel really fortunate that there's someone like you out there on the front lines who I'm sure is going to make a much larger impact policy-wise as well, but at least touching individual lives. I think that's so important. So thank you for all of the work that you do.
Thank you. And I mean, if anybody ever ends up stuck in a hospital or a clinic or anything and you feel scared and overwhelmed, ask someone on staff if there's a community health worker there. And everyone I've met they'll pull you out. They'll help you.
That's awesome. Great tip. Well, thank you so much, Caitlin, for making time